À tous. Hello, everyone.
Good morning.
Je suis très heureux d'être ici ce
I'm very
matin
happy
avec
to
les
be here this
ministres
morning
Hajdu
with
et
Ministers
Anand,
Hajdu
ainsi
and
qu'avec
Anand,
la Dr. Tam
as well
et le
as Dr. Tam and Dr. Njoo.
We have a lot of ground to cover this morning, so let's get right into it. I'll begin with vaccines. This morning, I visited the vaccination clinic at the Nepean Sportsplex here in Ottawa. It was great to see more and more people getting vaccinated. People were in a good mood. A lot of folks were there with their elderly parents. Everyone was chatty and focused, but quite frankly, it was the amazing volunteers who were working so hard who really encouraged us all, and we saw smiles on everyone's faces. I also had the chance to chat with a few of the many healthcare workers who are part of this vaccination effort. They're all doing an incredible job during this really tough time. My job as a politician is usually go around shaking hands, so that wasn't the challenge that we got to do. There was a number of older folks who I needed to remind that an elbow bump is the way we do it. But we're all figuring out how to navigate through this, and the fact that so many people are getting vaccinated is a really good thing. Our frontline workers have given up a lot to stay safe. Last week, I spoke to nurses from the Victoria General Hospital in Winnipeg. They shared what this past year has been like, caring for isolated patients in serious situations, sometimes being their only point of contact, and holding an iPad or holding their hands through a window while family members watch through a window. It was incredibly difficult, incredibly challenging for healthcare workers across the country, even more so when it comes to the fears that on returning home, they might be bringing home this disease to their families. It's been incredibly stressful, but they continue to step up every single day, and all of us need to make sure we're doing the best we can to keep them from getting overwhelmed and overloaded with new cases. But everything they do makes them the heroes of this pandemic. Présentement, notre plus grande priorité est de faire en sorte que le plus de Canadiens possible puissent être vaccinés le plus rapidement possible. Et on travaille sans relâche pour y arriver. À ce jour, on a livré plus de 6 millions de doses de vaccins aux provinces et aux territoires. Cette semaine, on va recevoir nos plus importantes livraisons jusqu'à maintenant avec 3,2 millions de doses. Ça inclut les livraisons prévues de Pfizer et de Moderna,
from Pfizer and Moderna, as well as 1.5 million doses of the AstraZeneca vaccine, which we will receive today from the United States.
As we've been saying for months, and as we've been planning with the provinces and territories since last year, the end of March will be followed by an increase in vaccine supply. We now have handily exceeded our promised target of 6 million doses delivered before April. And this week, we begin our ramp-up phase. Throughout April and May, 1 million doses a week are scheduled to arrive from Pfizer alone, plus Moderna, plus AstraZeneca. And for June, we have good news to share this morning. Pfizer has now confirmed that they will be moving up 5 million doses from later in the summer into June. That'll bring our total from 4.6 million to 9.6 million doses for that month alone. Of course, that's in addition to the other doses of the Moderna and AstraZeneca vaccines that we'll also get. A lot of doses being delivered means a lot of people who are able to get their shot. If you haven't had your vaccine already, it might be your turn or a family member's turn soon. If you want to learn more about vaccine safety and effectiveness, there'll be a Facebook Live event tomorrow where Dr. Tam, Dr. Njoo, and other experts will answer Canadians' questions directly. To attend or get more information, go to the Healthy Canadians Facebook page. Today, I also want to talk about where we are with the virus and what that means going forward. In some places, cases of COVID-19 are holding steady or even going down. And especially in long-term care homes, vaccination seems to be making a real difference in protecting people from outbreaks. That said, hospitalizations from COVID-19 remain high, and case numbers are going up in many regions here in Canada and around the world. Variants of concern, which can spread more easily and make people even sicker, are increasing quickly. In BC, where the number of cases had been under control, they're now having to put in place new restrictions for the next 3 weeks. I want to extend my full support to Premier Horgan and to all premiers across the country as they make tough decisions to keep people safe. As we have since day one, the federal government will have their backs and do whatever it takes to save lives, to protect our frontline workers, and to support jobs and businesses until we get through this. Il ne reste que quelques jours avant le début de la fin de semaine de Pâques.
Easter weekend is just a few days
a commencé samedi dernier.
Away.
C'est maintenant la
Jewish
deuxième année de
Passover
suite
started
que
last
ces célébrations
Saturday.
se déroulent
It's
en
now
temps
the second
pandémique.
year in a row that these
Malheureusement,
celebrations
ça
are
veut
taking
dire
place
qu'il faut
during a
continuer
pandemic.
de faire bien
Unfortunately,
attention.
this means that we
Dans la
must
dernière année, on
continue
a vu les
being
cas
very careful.
augmenter après d'autres
Unfortunately,
congés, comme
last
celui de
year,
l'Action de grâce
we
ou
saw
après
cases
Noël.
increase after
C'est
similar
très
holidays,
important
like
d'éviter une
Thanksgiving and
augmentation
Christmas.
après Pâques
So it's
si on
important
veut
for us to
continuer le
avoid
printemps
an
dans la
increase in
meilleure
case numbers
position
after
possible.
Easter. If you want to
Je sais que
continue
c'est
the spring in the
décevant, mais
best
il
possible
faut éviter
position,
les
I know it's
rassemblements.
disappointing,
C'est
but
pas
we
le temps
need
de
to
voyager.
avoid gatherings. This is not the
Continuez
time
de
to
porter
travel.
votre masque, de vous
Continue
laver
wearing
les
your
mains et
mask,
d'utiliser
washing your
l'application
hands,
Alerte
and using
COVID.
the COVID alert
La
app.
vaccination de masse
Mass
progresse bien.
vaccinations are
Le beau
progressing
temps s'en
well.
vient.
Beautiful
Mais il
weather
faut continuer nos
is
efforts un peu plus
is
longtemps.
around the corner, but we
Avec la
need to
hausse
continue our
récente des
efforts
cas dans
for a
certaines
while.
régions et
With the
les
increase
nouveaux
in
variants,
cases in
on
some
ne peut pas
regions and the
baisser
new
nos gardes.
variants, we cannot let our guard down.
Alors qu'on continue nos efforts pour
As we
protéger les
continue our
Canadiens,
efforts to
il ne faut pas
protect
perdre de vue que la
Canadians,
pandémie
let's
a
not
accentué
forget
les
that
inégalités à travers le
the
monde
pandemic
et a
has
eu un
widened
impact plus marqué
inequalities
sur
throughout
les
the world
populations
and
vulnérables.
has most
À ce
affected
sujet,
vulnerable
hier, avec le secrétaire
populations.
général des Nations Unies,
Together with the
Antonio
Secretary
Guterres,
General of the
le
United
Premier
Nations,
ministre de la Jamaïque,
Antonio
Njoo,
Guterres, the
et
Prime Minister
plusieurs
of
dirigeants
Jamaica,
mondiaux,
Andrew
on a
Holders,
tenu
and
une
several
troisième
global
rencontre sur le
meetings.
financement
We had a
du
third
développement.
meeting on development
On a discuté
financing.
de solutions concrètes pour
Yesterday,
aider les
we
pays les
discussed
plus gravement
concrete
touchés par la
solutions to
crise
help the
économique
countries
actuelle,
most affected by the
notamment
current
en ce qui a
economic
trait au
crisis,
surendettement et à l'aide
particularly as it
internationale.
relates to
Il faut adapter nos
over-indebtedness
systèmes
and international
économiques afin
aid.
qu'ils répondent
We
aux
need
enjeux
to
mondiaux
tailor our
urgents,
economic
tels
systems
que la
to
pauvreté
better
extrême,
respond
les
to
inégalités
urgent global
et bien
issues
sûr les
like
changements
extreme
climatiques.
poverty, inequalities,
Le
and of
Canada
course, climate
est toujours
change.
là pour
Canada
écouter
will
et pour
always be
agir.
there
Et on
to
va certainement
listen and to
soulever ces
act.
questions
And
lors de
we
nos
shall
prochaines
certainly
discussions
raise
avec le
these
FMI,
issues
la Banque
with
mondiale
our
ainsi
upcoming
que le
discussions
G20
with the
et le
IMF,
G7.
the World Bank, the G20,
As
and
we
the
rebuild
G7.
from this pandemic, we have to make sure no one gets left behind. Yesterday, Ministers McKenna and Monsef announced $250 million for transit in rural and remote communities. This fund is part of the unprecedented public transit investment we announced last month, and it is the first federal fund dedicated to rural transit. This is part of our job to create jobs and fight climate change. It's also about building more inclusive communities where seniors can get to their doctor's appointments and where people of every age can get the services they need. Before I end today, I want to say a few words about Easter and Passover. Again this year, we won't have the kinds of celebrations we were all hoping for because we just can't afford to let our guard down. I know I've said the same thing before every major holiday over the past year, but this time, what's different is that even if the end of the pandemic is in sight, the variants mean the situation is even more serious. We're entering the final stretch of this crisis. We just need to stay strong a little longer. More and more vaccine doses are coming every week, so there's reason to be hopeful. So please, keep yourself and your loved ones safe. Now is not the time to travel. Avoid gatherings and parties, and continue to keep your distance. I know it's not easy, but together we will get through this. Merci. Je suis maintenant heureux de passer la parole à la ministre
I'm
Anand.
happy to now give
Anita.
the floor to Minister Anita Anand.
Good morning, and thank you for joining us today. By the end of this week, Canada will have received approximately 9.5 million doses of approved vaccines from 3 manufacturers, Pfizer, Moderna, and AstraZeneca. This is well ahead of the 6 million doses that we had originally projected for the first quarter of this year, with 3.2 million doses arriving this week. The work to accelerate the delivery of doses continues every day. Comme le Premier Ministre vient de l'annoncer,
as the Prime Minister just announced, Pfizer-BioNTech is again accelerating deliveries to Canada with an additional 5 million doses arriving in June. Canada will receive at least 1 million doses of the Pfizer-BioNTech vaccine every week from now until the end of May, and in June, that will be 2 million doses a week.
As the Prime Minister just announced, Pfizer-BioNTech is again accelerating deliveries to Canada with an additional 5 million doses arriving in June. Canada will receive at least 1 million doses of the Pfizer-BioNTech vaccine every week from now until the end of May, and in June, that will be 2 million doses a week every week. Canada was among the very first countries in the world to sign a deal with Pfizer, and we have worked constructively with the company and all suppliers in order to ensure a stable supply of vaccines for our country. Originally, we had contemplated approximately 8 million Pfizer doses in the second quarter alone. And now, due to successive negotiations with the company, we are set to receive close to 18 million doses of Pfizer by the end of June. This means millions more additional doses available to be administered to Canadians by the first days of summer. We said that when vaccines were ready, Canada would be ready, and we are, with a diversified portfolio of vaccines. This is why, in addition to the accelerated Pfizer doses, 1.5 million doses of AstraZeneca's vaccine were loaded onto trucks this morning in the United States and are en route to Canada as we speak. We also expect 4.4 million additional doses of AstraZeneca before the end of June. Combined across the currently approved vaccines, Canada is now on track to receive at least 44 million doses of vaccine by the end of June, and very well on the way to having more than enough to ensure that every Canadian who wishes to be vaccinated can be fully vaccinated by the end of the summer. Bien qu'il s'agisse d'une excellente nouvelle,
while this is very welcome news, it does not mean that our government is relenting on moving doses forward whenever possible.
Et nous poursuivons notre travail,
our work continues, as does the work of every Canadian, to remain vigilant and continue to follow public health guidelines.
The Government of Canada will continue to bring vaccines into this country while managing the inherent volatility in global supply chains for this product. We will see through this challenge together. Merci beaucoup.
Thank you very much.
And we'll turn it over to Dr. Tam.
Bonjour à toutes et à tous.
Good morning,
Today
everyone.
we'll touch on the recent safety signal associated with the use of the AstraZeneca vaccine in adults under 55 years of age. But first, we'll begin with an update on the current numbers and trends. COVID-19 activity has been steadily increasing for several weeks, with a rising number and proportion of more contagious variants driving epidemic growth in many areas. To date, over 970,000 cases of COVID-19, including 22,900 deaths, have been reported across Canada. Over the past week, there have been an average of over 4,600 new cases and 26 deaths reported daily. The ongoing increase in infection rates is now playing out in our hospitals, with rising trends in severe and critical illnesses placing renewed strain on the health system. Over the past week, an average of over 2,200 people with COVID-19 were being treated in our hospitals each day, representing a 6% increase over last week. Over 660 of these people were being treated in intensive care units, which is 14% higher than last week. Most concerning is the continued increase in number and proportion of variants of concern that spread more easily and increase the risk of severe illness outcomes. Over the past week, there has been a 64% increase in new variant cases. To date, over 9,000 variants of concern cases have been reported across Canada, with the B117 variant accounting for over 90%. New variant case numbers represent the tip of the iceberg, as there are thousands more cases that have screened positive for problematic mutations. Yesterday, Health Canada issued a statement in relation to new data on additional cases of a rare type of blood clot known as vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT, which occurred following the administration of the AstraZeneca vaccine in several European countries. To date, no cases of VIPIT has been reported in Canada. Nevertheless, as the data on these additional cases could change the risk-benefit assessment, Health Canada, as regulator, has put in place additional terms and conditions on the authorization of AstraZeneca vaccine in Canada. In the interim, Canada's National Advisory Committee on Immunization has recommended to pause the use of AstraZeneca vaccine for people aged under 55 years, pending a full risk assessment by Health Canada. Chief Medical Officers of Health have considered NACI's recommendations and have issued a statement outlining a unified decision to take this precautionary measure. I know that this is another difficult development in the seemingly never-ending twists and turns of this pandemic, but there is a point of grace. I couldn't have said it better, so I would just like to quote Dr. Menaka Pai, Associate Professor of Hematology and Thromboembolism at McMaster University, who notes, strong global vaccine safety surveillance rapidly picked up this rare and serious adverse event. Collegiality, academic rigor, transparency, and medical science will help us manage it. As spring begins, warmer weather and as important religious observations such as Passover, Easter, Vaisakhi, and Ramadan are upon us, we too must do our best and remember our duty to protect one another. COVID-19 activity levels are different depending on where you are in Canada, but there is a risk of introduction and rapid acceleration of cases everywhere. Please continue to follow local public health recommendations, stick to safer ways we've learned to celebrate during COVID-19, and save gatherings for a better time in the future. Despite the hurdles, we are getting closer every day, and we're stronger and more united for it. Thank you.
Bonjour à toutes et à tous.
Good morning,
Aujourd'hui,
everyone.
nous allons aborder le récent
Today
signal de
we'll touch on the
sécurité
recent safety
associé à
signal
l'utilisation du vaccin
associated with the
d'AstraZeneca
use of the
chez les
AstraZeneca
adultes de moins de
vaccine in
55
adults
ans.
under 55
Mais tout
years of
d'abord,
age.
nous allons commencer
But
par faire
first,
le point sur
we'll
les
begin with
chiffres
an
et les
update on the
tendances
current
actuelles.
numbers and
La
trends.
transmission de la COVID-19 est en augmentation
COVID-19
constante
activity has been
depuis
steadily
plusieurs
increasing
semaines,
for several
avec un
weeks,
nombre et une proportion
with a
croissante de
rising
variants
number
plus
and
contagieux
proportion
à
of
l'origine
more
de la croissance
contagious
épidémique
variants
dans de
driving
nombreuses régions.
epidemic growth in
À
many
ce jour,
areas.
plus
To
de
date,
970 000
over
cas de COVID-19,
970,000
dont
cases
22
of COVID-19,
900 décès ont été
including
signalés au Canada.
22,900 deaths
Au
have
cours
been
de la semaine
reported
dernière,
across Canada.
nous avons enregistré en moyenne
Over the
plus de
past
4
week,
600 nouveaux
there have
cas
been an
et
average of
26
over
décès par jour.
4,600 new cases and
L'augmentation
26
continue des
deaths
taux
reported
d'infection
daily.
se
The
répercute
ongoing
maintenant dans
increase
nos
in
hôpitaux,
infection rates is
avec une
now playing
tendance à
out in our
l'augmentation
hospitals,
des
with
maladies
rising
graves et
trends in
critiques
severe and
et une nouvelle
critical
pression sur les
illnesses,
systèmes de
placing
santé.
renewed
Au
strain
cours de
on the
la
health
dernière semaine,
system.
une moyenne de
Over the past
2200
week,
personnes
an
atteintes de
average
la
of over
COVID-19 ont
2,200
été
people
traitées
with
dans nos hôpitaux chaque jour,
COVID-19, were being treated in our
de
hospitals
6%
each
par
day,
rapport à la semaine
representing a
précédente.
6% increase
Plus de
over last
660
week.
de ces personnes ont
Over
été traitées
660
dans des
of
unités
these
de soins
people
intensifs,
were being
ce qui
treated in
représente une
intensive care units,
augmentation de
which
14%
is
par rapport à la semaine
14% higher
précédente.
than last
Le
week.
plus inquiétant est
Most
l'augmentation continue
concerning
de
is
nombre
the
et de la
continued
proportion de
increase
variants
in number
préoccupants
and
qui se propagent
proportion
plus facilement
of
et
variants of
augmentent le risque
concern
d'apparition
that
des
spread
maladies
more
graves.
easily and increase the
Au
risk
cours
of
de la
severe
dernière
illness
semaine, nous
outcomes.
avons enregistré
Over the
une
past
augmentation
week,
de
there has been
64% des
a
nouveaux cas de variants, avec plus de
64%
9
increase
000
in
cas de
new
variants
variant cases.
préoccupants
To
signalés à
date,
ce jour au
over
Canada.
9,000
Le variant
variants of concern
B117
cases have been reported
représentant
across
plus de
Canada, with the
90% des cas.
B117
Un nombre
variant
de cas de nouveaux
accounting for
variants
over
ne représente que la
90%.
pointe de l'iceberg, car des milliers d'autres cas ont
This
été
includes
dépistés positifs pour des mutations
8,381
problématiques.
B117
Hier,
variants,
Santé Canada a
358
publié
P1
une
variants, and
déclaration
270
concernant des
B135
nouvelles
variants
données
reported
sur
to
des cas
date.
supplémentaires
New
d'un
variant
type
case
rare
numbers
de
represent
caillots
the tip of the
sanguins,
iceberg, as
connu
there are
sous le nom
thousands
de
more cases that
thrombocytopénie
have been screened
immunitaire
positive for
prothrombotique
problematic
induite par un
mutations.
vaccin,
Yesterday,
ou
Health
TPIR,
Canada issued a statement in
survenu
relation to
après
new data
l'administration de
on
vaccins
additional
contre la
cases of a rare
COVID-19
type of blood
d'AstraZeneca
clot
dans
known as
plusieurs pays
vaccine-induced
européens. À ce
prothrombotic
jour,
immune
aucun cas de TPIR n'a été
thrombocytopenia
signalé au
or
Canada.
VPID, which occurred following the
Néanmoins,
administration
comme
of the
les données sur
AstraZeneca
ces cas
COVID vaccine in
supplémentaires
several
pourraient
European
modifier
countries. To date,
l'évaluation sur
no
le
cases
rapport
of VPID
entre
have
les
been
risques et
reported in
les
Canada.
avantages,
Nevertheless,
Santé
as the
Canada,
data on
en
these
tant
additional cases could change
qu'organisme
the
de
risk-benefit
réglementation,
assessment,
a
Health
imposé des
Canada, as
conditions
regulator,
supplémentaires
has put in
pour
place
l'autorisation des
additional
vaccins
terms and
d'AstraZeneca au
conditions
Canada.
on the authorization
Entre-temps,
of
le
AstraZeneca
Comité
vaccines in
consultatif
Canada.
national de
In the
l'immunisation,
interim,
CCNI,
Canada's
du
National
Canada a
Advisory
recommandé de
on
suspendre
Immunization,
l'utilisation du vaccin
NACI, has
d'AstraZeneca
recommended
chez
to
les personnes
pause the
âgées de
use of
moins de
the
55
AstraZeneca
ans,
vaccine
en
for people
attendant une
aged under
évaluation
55
complète
years,
des risques par
pending
Santé
a
Canada.
full risk
Les
assessment by
médecins
Health
hygiénistes en
Canada.
chef ont examiné
Chief
les
medical
recommandations du
officers of health
CCNI et ont
have
publié une
considered NACI's
déclaration décrivant
recommendations
la
and
décision
have
unifiée
issued
de
a
prendre cette mesure
statement
de précaution.
outlining a unified
Nous savons
decision
qu'il
to
s'agit
take this
d'un autre changement
precautionary measure.
difficile dans
I
le
know this is
rebondissement
another
apparemment
difficult
sans fin de cette
development
pandémie.
in the
Mais il y
seemingly
a un point de
never-ending
grâce.
twists and
Nous
turns of
n'aurions
this
pas
pandemic.
pu mieux dire,
But
alors nous
there
aimerions
is a point
citer
of grace.
Dr. Menaka
I
Pai,
couldn't have said it
professeur
better, so I would
agrégé
just
de
like to quote Dr.
débotologie et de
Menaka Pai,
thromboembolie à l'Université
Associate
McMaster,
Professor of
qui a déclaré
Hematology
la
and
surveillance
Thromboembolism at
rigoureuse de
McMaster University,
l'innocuité
who
des
notes,
vaccins à l'échelle mondiale
strong
a
global
permis
vaccine
de
safety
détecter rapidement
surveillance
cet effet
rapidly picked
secondaire
up this
rare
rare
et
and
grave.
serious
La
adverse
collégialité,
event.
la rigueur théorique, la
Collegiality,
transparence et la
academic
science
rigor,
médicale nous
transparency,
aideront
and
à le
medical
gérer.
science will help us
Alors
manage
qu'il
it.
fait plus chaud au printemps
As
et que
spring
d'importantes
brings warmer
pratiques
weather,
religieuses comme la Pâque,
and as
juive,
important
Pâques,
religious observances such
Vaishakhi
as
et le
Passover,
Ramadan sont à nos portes,
Easter,
nous devons nous
Vaishakhi,
aussi faire de
and
notre
Ramadan
mieux
are upon us. We
et nous
too
rappeler notre
must
devoir de
do
nous
our best
protéger les uns les
and
autres.
remember our
Les
duty to
niveaux de
protect one
transmission de
another.
la COVID-19 sont différents selon
COVID-19
l'endroit
activity
où
levels
nous
are
nous trouvons au
different
Canada,
depending
mais
on
il
whether
existe
you
un
are
risque d'introduction et
depending on where you are
d'augmentation
in
des cas
Canada, but there
partout.
is a risk of
Veuillez
introduction
continuer à
and
suivre
rapid
les
acceleration of
recommandations de
cases
santé publique
everywhere.
locale,
Please
à
continue
vous en
to follow
tenir aux
local
méthodes plus sûres
public
que
health
nous avons apprises
recommendations.
pour faire la
Stick to
fête
the
pendant la
safer ways we've
COVID-19
learned to
et à
celebrate
garder
during
les rassemblements
COVID-19
pour un meilleur
and
moment
safe
à
gatherings
l'avenir.
for a better time in the
Malgré les
future.
obstacles, nous nous rapprochons chaque
Despite the
jour du but
hurdles,
et nous
we
sommes
are
plus
getting
forts et
closer
plus
every
unis
day and
pour
we are
cela.
stronger and more
Merci.
united for it. Thank you.
Thank you, Dr. Njoo. Now we'll turn to questions from media. We'll start on the phone, and after we're done, the ministers and doctors will be available once the Prime Minister leaves after a few questions as well. Operator, over to you.
Thank you. Merci. Première question, Raymond Fillon, TVA. À vous.
First question,
Merci,
Raymond
bonjour,
Fillon,
Monsieur le Premier
TVA.
ministre.
Thank you. Good
Vous
morning,
avez dit
Mr.
lors
Prime
d'une entrevue la
Minister.
semaine
During an
dernière, ça va
interview
prendre
last
un
week,
petit bout
you
de temps
said
en
it will
parlant du
take
moment
some
des
time
prochaines élections.
talking about
Est-ce
the
dire que si
next
votre budget
elections.
passe à la Chambre des
If
communes,
your
vous
budget
écartez la
is
possibilité de
adopted in the
déclencher
House
des
of
élections ce
Commons,
printemps?
Will there be no
Comme j'ai dit
possibility of
depuis tout
triggering
début,
elections
Ray,
in the spring?
moi, ma
Answer. As I said from the very
c'est de passer
beginning,
à travers la
my
COVID
priority
et de
is
continuer
overcoming
à assurer
the COVID crisis
un retour
and
économique
continuing to make
en
sure
force.
that there is a
C'est
strong
notre
economic
priorité en tant que
recovery.
gouvernement.
That is our
Évidemment,
priority
dans
as
un
a
Parlement
government. And
minoritaire,
of
on ne
course,
sait jamais ce qui
in
va
a
se passer avec les
minority
autres
parliament,
partis.
we never know
Et
what
je
is
l'ai
going
dit
to
très,
happen
très
with the other
souvent, nous avons
parties.
besoin
As I've
de se
often said,
concentrer sur
we need to
cette
focus
pandémie
on
tous
this
ensemble.
pandemic
Nous avons
together.
besoin d'avoir un
We
Parlement
all
qui fonctionne.
need
Nous
a
avons besoin
parliament that is
de
working.
continuer à
We
livrer
need
pour
to
aider les
continue
Canadiens et pour
delivering
faire
to
rebondir
help
notre économie.
Canadians and to ensure economic recovery.
Compte tenu que la troisième vague
Question.
passe son plein dans
Considering that
plusieurs provinces,
we are right in the
l'Ontario,
middle
le
of a
Québec,
second week in
plusieurs
many
experts qualifient
provinces,
la
Ontario,
trajectoire des courbes
Quebec,
d'alarmante.
many
Vous avez dit vous-même
experts
hier, on n'est
describe
pas
it
sorti du
as
bois. Est-ce que ce
alarmic. We
serait
are not out of the
responsable
woods yet.
d'avoir des
Will it
élections
be
ce printemps?
responsible to organize
Je pense
elections this
qu'il
spring?
faut,
Answer.
faut se rappeler que notre
Let's
démocratie
remember
est
that
forte et
our
on va
democracy is
pouvoir se
strong
débrouiller, mais
and
c'est
we shall
certain
manage.
que moi,
But
ma
it is
préférence, c'est de
certain
pouvoir
that what I
continuer
prefer
à
is
travailler
that we
directement pour
continue
les
to work
Canadiens, à
directly
livrer
to
les
help
mesures
Canadians
d'aide
to
dont les familles
deliver
ont besoin,
measures to help
d'investir pour
families,
appuyer les petites entreprises,
to help
pour assurer qu'on est en train
small and
aussi
medium-sized
de lutter contre les
enterprises,
changements
and to make
climatiques
sure
tout
that
en
we also fight
réglant
climate
le cours
change.
de cette pandémie. Nous avons bien des choses que nous
While
devons
we are
faire.
fighting the
En
pandemic,
tant que
there are many
gouvernement,
things
nous
we need to
restons
do.
concentrés
As a
là-dessus.
government, we are
Évidemment,
focusing
ça
on that,
prend
of
un
course.
Parlement qui
It
continue à
takes
fonctionner,
a
mais
parliament that
j'ai de
continues to
l'espoir
function,
que
but I do hope.
c'est la priorité aussi des
I
autres
also hope
partis
it's
de
also the
travailler
priority
pour les
of other
Canadiens et non pour leurs
parties to
fins
work
politiques.
for Canadians and not for their
Merci.
own
Prochaine
political
question.
purposes. Thank you. Next question.
Thank you. Merci. Next question, Ryan Tamilty, National Post. Line is open.
Yeah, good morning, sir. I'm wondering, with the system that we have now in which Health Canada approves vaccines and then NACI makes recommendations, in this case of the AstraZeneca vaccine, it seems to be sowing some confusion and some hesitancy, having Health Canada say a vaccine is safe for all groups, but then having NACI say that it should only be used for people over the age of 55. I'm wondering if you think fundamentally the structure maybe isn't fit for a pandemic, even if it works during normal times.
I think what we saw yesterday, Ryan, was all the different levels of organizations of experts coming together, whether it was public health officials across the country coming out with a coordinated statement, or Health Canada and NACI working together to ensure that there is coordination in the messages. Look, I understand how challenging this can be for Canadians. The science is evolving as we get more and more data. Experts are refining and shifting their recommendations. Canadians need to know that every step of the way, there is one thing driving all these experts, and that is keeping Canadians safe and getting through this pandemic as quickly as possible. That is the underlying element to every recommendation, to every decision that is put out there. And I can tell you that the work that is being done is extraordinary, not just here in Canada, but coordinating with people around the world. The bottom line for Canadians is the right vaccine for you to take is the very first vaccine that you are offered. The more we get Canadians vaccinated quickly and safely, the quicker we'll be able to get back to a semblance of normality. With the variants that are more severe and more transmissible, increasing around the population, we need to make sure we're doing everything we can to get through this.
Follow up, Ryan?
Yeah, so just as a follow-up, on the issue of vaccine hesitancy overall, we've seen reports that in some long-term care facilities, only 60 or 70% of the staff are taking the vaccine. Toronto actually had to put a big push to get people into vaccine appointments last week. Are you concerned now that we have this flood of vaccines coming, are you concerned about hesitancy and about not getting people to take them quickly enough to end the pandemic?
I think it's certainly something that is on our mind. We know that the way to get through this is to get as many people as possible vaccinated, and that's certainly our focus. But we're seeing, as I saw this morning at the vaccine clinic here in Nepean, people are positive and enthusiastic about getting vaccinated, and I think people understand that the way to protect us all is for people to get vaccinated. But maybe I'll turn to Dr. Tam for further thoughts on your first question and on the hesitancy question. Theresa.
Yes. On the first question, there are different roles for the different groups, but as the Prime Minister said, we worked lockstep, each playing its role. So Health Canada, being the regulator, triggered a signal to the manufacturer to say, we need more data. We need it to be broken down by age and sex to look for this more serious and rare side effect that is been seen following immunization, even though we haven't seen it yet in Canada. With that, while the data is being gathered, we amass experts from Canada, but also had experts from Germany providing with their first-hand interpretation of what this clotting with low platelets entity is like and some of the underlying scientific explanations. With that, the National Advisory Committee on Immunization looked into that and said, you know, while we're waiting for this information and more information to come, we've seen enough of the science, but also what we've seen already coming out of the European countries to say, take the precautionary approach. And given the data that we've seen, where most of these rare cases occur in the under 55s, that's the recommendation they have provided to pause offering the AstraZeneca vaccine for this age group for now. And then all the chief medical officers got together, having heard all of this as well, and made a unified position to take this precautionary approach. So that's how that all worked together. But all of it had to be done really quickly. And so I think you've seen that at play yesterday to take the precautionary approach to keep Canadians as safe as possible while offering a safe and effective vaccine.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Mélanie Marquis, La
Mélanie
Presse. À
Marquis,
vous.
La Presse.
Merci. Bonjour, Monsieur Trudeau.
Good morning,
C'est un
Mr.
peu
Trudeau.
difficile de se retrouver en matière d'approvisionnement. Hier, surtout avec la pause d'AstraZeneca pour les personnes de 55 ans et moins.
The prohibition of AstraZeneca for under 55. Today you are saying that there will be more doses from Pfizer in June. Could you please tell us the objective the government set for end September to vaccinate all adults who wanted to be vaccinated?
Mélanie.
What's the situation?
Comme vous savez, ça fait depuis l'été passé
Thank you, Melanie. As you know,
des contrats
since
avec les
last summer, we've been
Même avant
signing
qu'on sache
contracts
quel
with
vaccin
vaccine
allait
companies.
être le
Even
plus
before we
efficace,
knew
on s'est assuré d'avoir
what
une
vaccine
gamme
was going to be the
de
most
différents
effective.
vaccins
We wanted
potentiels
to
pour
make sure that we had
être
a
mieux
wide
positionnés.
variety of vaccines
On
to
avait
be
dit, à
better
partir de fin
positioned.
novembre, début
We
décembre
said
l'année
that
passée, qu'on
We
s'attendait
said
à
by end
avoir
November, early
6
December,
millions de
that we were
doses de
expecting
vaccins
to
au
receive
Canada
6 million doses
avant
of
la
vaccines in
fin
Canada
du premier trimestre,
by the
c'est-à-dire
end of
avant
the
la
first
fin
quarter.
mars.
That
Mais
is
nous
by the
voilà
end of
à la fin
March.
mars et non
Here we
seulement
are
est-ce qu'on a
end
plus
March.
que
Not
6 millions
only
de
do we
doses,
have
mais
more than
à
6
la fin
million
de cette
doses,
semaine, on
but
compte
by
avoir
the
plus
end
que
of this
9
week, we
millions de doses
we will
de
be
livrées
having
au Canada
more than 9 million
pour
doses of
pouvoir
vaccines delivered
accélérer le
to
processus.
Canada
Donc,
to be
le
able to speed
travail
up the
qu'on est en train de
process.
faire depuis des
So
semaines
the
et des
work we've
semaines
been doing
pour
for weeks and
augmenter le
weeks
débit
to
d'arrivée des
increase
vaccins
the pace of the
va
arrival
continuer.
of
C'est
vaccines will
d'ailleurs
continue.
ce qu'on a pu annoncer
And
aujourd'hui
that
que
is what
d'ici
we
la fin
announced
mai,
today.
on va
By end of
continuer
May,
d'avoir
we
1
will
million de
continue
doses de
receiving
Pfizer
a
par
million
semaine,
doses from
mais
Pfizer per
au
week.
mois de juin, ça
But
va
in
être 2
June,
millions
it will be
de
2
doses de
million
Pfizer.
doses
Tout ça
from
pour
Pfizer.
dire qu'arrivé à
I'm
la fin
simply trying
juin,
to say
on
that
parle
by end of
d'avoir
June,
plus que 40
we will be
millions
having
de
more than
doses
40
de vaccins
million
arrivés au
doses of
Canada,
vaccines
ce
delivered
qui
to
nous met
Canada.
en très bonne
And
situation
this
pour
would
dire
place us in a
qu'avant la
very
fin
good
de l'été,
situation
tout le monde au
where we'll
Canada
be
va
able to
pouvoir
say
être
that by the
vacciné
end of
avec
the
les 2
summer,
doses.
everyone would have
Et
received
même,
2 doses.
dépendamment de comment les
And
provinces distribuent
depending on
ces
the
vaccins, c'est
distribution of the
possible
vaccines
que
by the
beaucoup de
provinces,
gens
it's
aient au
possible
moins leur
that
première
many
dose
people would have received
avant
at
que
least
l'été
their
soit vraiment
first
lancé.
dose
Alors,
before the
on
summer
est tout à
starts.
fait enlignés pour atteindre nos objectifs
we are
et même
set to meet
les
our
accélérer un
objectives
petit peu,
and
mais
even
on lâche pas
accelerate
notre
them.
travail à tous les jours
But we are
d'assurer
working every
que,
day
avec des
to
défis avec
make
différentes
sure
compagnies,
that
avec des
in
problèmes de
spite of
production
the
avec d'autres
challenges with the
compagnies, on
companies,
puisse
production
être confiant
challenges,
que les Canadiens vont s'en
consultations with
sortir
companies, we
le
want
plus
to make
rapidement
sure
possible.
that Canadians overcome as quickly as possible.
Juste
Follow-up question?
oui, un suivi. Juste clarifier,
Answer.
au
A
Québec,
question.
M. Trudeau, on a donné
Clarification.
une
In
date
Quebec,
le
a
24
date,
juin. Vous n'en donnez
24th
pas.
of
Je
June
comprends
was
que vous
provided.
dites
You
la
are
fin
not
de
giving
l'été, mais
any
la fin de l'été,
dates.
ça peut être le 20
You're talking
septembre,
about the
comme
end
pour
of
certains,
the
ça peut être
summer.
le 15
It could
août.
be the 20th
Donc, est-ce
of
qu'il y a une
September.
date
For others, it's the
particulière sur laquelle
15th of
vous avez
August.
un X sur votre
Can
calendrier?
you give us
Puis
a
aussi,
date?
par rapport au Pfizer qui arrive
Talking
plus tôt
about
au mois de juin, je
Pfizer
sais que
coming,
vous ne
doses
dévoilez pas
coming
les termes
earlier, end of
contractuels,
June.
mais
I know
pouvez-vous
that
dire
you don't
si,
want
il a
to
fallu payer une prime pour que les
publish
doses arrivent plus tôt?
contractual terms.
D'abord,
Could you say more about that?
je reconnais
Answer.
que les
First
choses
of
avancent
all,
bien
I
au Québec.
recognize
Je veux
that things are
souligner
progressing
d'ailleurs
well in Quebec.
qu'on a tous été très contents
We
de
were
voir
very happy
le premier ministre
to
Legault
see
se faire vacciner. Ça
Premier
montre vraiment à
Legault
quel point les choses
vaccinated.
vont de bon
That
train
shows
au Québec
how well
et
things are
partout,
going in
partout au
Quebec
pays.
and throughout the country.
Par rapport aux dates
Relating
précises,
to
on a dit depuis
specific
le
dates,
début
from
que
the very
tout le
beginning,
monde,
we
tous les
said
adultes allaient
that
avoir
all
leur
adults
pleine
were going
vaccination,
to
c'est-à-dire
receive
2 doses
2 doses
pour
of the vaccine
septembre
by September
2021.
2021.
En même temps, on
At the
sait
same
très bien
time,
qu'il y a plusieurs
we do
provinces
know
qui prennent une
that many
stratégie
provinces
de une dose
have
pour tout le
adopted
monde
a strategy of
plus
one dose for
rapidement.
everyone
Et donc,
more
certaines
rapidly.
provinces peuvent mettre,
So some
peuvent
provinces
mettre de l'avant d'autres dates fixes.
may come
Nous,
up
notre
with
job, c'est
specific
d'assurer
dates. Our job
l'arrivée
is to
du
make
plus
sure
grand nombre de
that
vaccins
the
pris
greatest
par le
number
gouvernement
of
fédéral
vaccines approved
dans
by the
les
federal
mains des
government
provinces pour les
arrive
mettre dans les bras des Canadiens
and get to
le
the
plus
hands of the
rapidement.
provinces so
Comme
that
j'ai
people
dit,
can be
ça
vaccinated
va
as
très
quickly
bien,
as
mais
possible.
nous
As
allons
I said,
continuer de
things are
travailler extrêmement
moving
fort
well.
pour
We will
accélérer
continue
encore
working
plus.
hard to speed up
Et
things
je
even
peux
more.
tourner vers la ministre Anand pour
Let me turn to
préciser
Minister
s'il y a des
Anand
coûts par
to
rapport
say
à
if
ces
there are
5
any
millions de doses de
costs
Pfizer qui arrivent
associated to the
plus
additional
tôt, mais
5
je ne
million
crois
doses
pas,
from Pfizer
mais
that are
c'est à elle
arriving
de
earlier.
répondre.
But I don't believe so, but it's up to her to answer that question.
Merci beaucoup. C'est la même
Thank you
prix
very
par
much. It's the
dose
same
pour
price per
les
dose
5 millions de
for the
doses.
5 million
Et Premier
doses.
ministre, vous avez raison. Et
Prime
toutes les autres
Minister,
choses.
you are
Merci.
right. You are right on the others as well. Thank you.
CBC. Is it possible to say at this point what impact these new restrictions on AstraZeneca are going to have on the overall vaccine rollout? And I guess the longer these restrictions stay in place, is that going to compound whatever impact there is?
I'll turn to Minister Anand, but I can say that our portfolio of vaccines was, from the very beginning, as we've seen, extremely heavily weighted towards Moderna and Pfizer. The fact that we are getting 1 million Pfizer doses every single week over the coming weeks, rising to 2 million a week for the month of June. The fact that the target of 6 million doses for Canadians by the end of March, by right now, was based on Pfizer and Moderna alone, means that we are still in very good situation. But of course, we want to get more doses of more varied vaccines, and ensuring the continued delivery of those doses rapidly, including the AstraZeneca doses, to as many Canadians as possible in the coming months, continues to be our priority. Anita, to follow up on that.
Thanks, Prime Minister. Just to build on that, the advice of the Vaccine Task Force, of course, was to procure vaccines from 7 leading vaccine manufacturers. And the minimum amount of doses was 20 million for every 2-shot vaccine and 10 million for J&J. But in addition to that, we exercised options to purchase additional Moderna and Pfizer doses. So as the Prime Minister said, we are heavily weighted on Moderna and Pfizer as a result of exercising those options. We have 44 million doses of Moderna coming to Canada overall and 40 million doses of Pfizer coming to Canada overall. And as you're aware, 22 million doses of AstraZeneca. So we are continuing to exercise and see the benefits of a diversified portfolio of vaccines. Yes, we are heavily weighted on Moderna and Pfizer at the current time, but what we use as our baseline is the approval of Health Canada. Once a vaccine is approved by Health Canada, it is safe and effective. And from a procurement standpoint, that means all systems are go to bring those vaccines into the country, which is exactly what PSPC does every single day. Thank you.
Glenn McGregor, CTV News. Prime Minister, 2 weeks ago, we had heard reports about blood clotting issues with the AstraZeneca vaccine, yet you came out and assured Canadians that it was safe, and you encouraged them to go get it if it was offered to them. Now we know that there are concerns about this in younger people. Was it a mistake for you to do that? And do you think will that change the way you give advice about vaccines in future? And finally, what would you say to the Canadians who, based on your advice 2 weeks ago, went out and had that AstraZeneca shot?
The advice given by health professionals, the advice that I gave, was that the right vaccine for you is the very first vaccine that is offered. And Health Canada continues to ensure the safety and effectiveness of any vaccine administered in Canada. As we've seen over the past number of weeks, there are different recommendations and limitations given in as the science evolves. But every step of the way, the recommendations that Health Canada makes and that I and other politicians pass along, because none of us are vaccine experts, but we are there to help amplify the messages by Health Canada that vaccines are safe and effective and that everyone needs to get vaccinated with whatever vaccine is offered to them as quickly as possible. But I will turn to Theresa for follow-up on that. OK, avant de passer, écoutez, notre travail en tant que politicien, c'est de passer aux citoyens, de rassurer les citoyens sur les messages des experts et les conclusions des experts. Et ce qu'on dit depuis longtemps demeure la réalité. Le meilleur vaccin pour vous,
the reality. The best vaccine for you is the very first one you are offered. We want to make sure that we vaccinate as many people as possible, as quickly as possible. Yes, the more we receive data, the more information we will have on possible adverse effects. But experts in Canada and throughout the world are making sure that the vaccines are safe and on the best way of delivering those vaccines to Canada, and that will continue to be our priority. Theresa.
Yes, so the advice on any medication or vaccine can evolve over time. And I think Canadians should be reassured that we have systems in place to detect safety signals and then analyze them. As I've said in my opening remarks, it's actually been quite a remarkable feat of international collaboration and science to try and sort out the initial reports. And I think the change in advice has been because there is now more information and that was made available. And still, even if the events were rare, while things are being worked out, that's the balance of risk and benefit was sort of examined. And that was the position and the advice that Health Canada and the National Advisory Committee on Immunization had provided. Every medication or vaccine can come with rare side effects, which will not be picked up until many millions of people receive the vaccine. The initial clinical trial with tens of thousands will not pick up rare events. So I think the important thing, to emphasize to everyone is that we have systems and checks and balances in place. But please do remember that over the course of the administration of the vaccine to many millions of people in the world, if there should be any new signals, we will be communicating that after a thorough examination. But science will continue to evolve in this space. On those over 55 years of age and over, the balance of risk and benefit is such that, the impact of COVID is much more serious in the older age groups. And that's the concern. We have a rising third resurgence, and with an acceleration of cases, and with the serious outcomes in older populations, when compared to a relatively rare event, That's how NACI made its recommendation as well. And as Minister Anand and the Prime Minister has stressed, we do also have a fundamental base of mRNA vaccine.
Bonjour, M. Trudeau, Louis Blouin de Radio-Canada. Tantôt, vous avez parlé du Québec où l'opération se déroule bien. En Ontario, ça ne va pas très bien. Et le premier ministre Ford dit, écoutez, ça nous prend plus de vaccins. On voit des interruptions dans l'opération de vaccination. Qu'est-ce que le gouvernement peut faire pour aider l'Ontario dans cette situation-là qui est difficile? Et qu'est-ce que les provinces peuvent faire de leur côté? Est-ce que ça prend un resserrement des mesures à ce moment-ci alors que le printemps revient? Est-ce qu'il n'y a pas un besoin de faire ça de leur côté?
D'abord, en tant que gouvernement fédéral, c'est à nous que ça revient de procurer les vaccins, les doses de vaccins, et c'est ce qu'on fait depuis bien des mois. On avait promis 6 millions de doses pour la fin mars. On est rendu à en avoir presque 9 millions d'ici la fin de cette semaine. Donc, on est en train de livrer encore plus de vaccins que ce à quoi les provinces s'attendaient. Nous allons continuer d'être là pour les appuyer dans l'administration de ces doses là où ils en ont besoin. On va toujours être là pour travailler en équipe. Je pense que c'est ce à quoi les Canadiens s'attendent, que tout le monde reste concentré en position de leadership sur la livraison de vaccins et c'est exactement ce qu'on est en train de faire. Par rapport aux mesures sanitaires publiques, je pense que c'est important que chaque province continue de prendre ses propres décisions, mais on peut très clairement constater qu'il y a un sérieux danger ou une préoccupation avec ce troisième vague potentiel de nouveaux variants qui sont plus transmissibles et qui ont des impacts plus sérieux. Donc, nous allons être là en tant que gouvernement fédéral pour appuyer les provinces comme on est là pour appuyer la Colombie-Britannique, par exemple, qui vient juste d'amener un resserrement de 3 semaines pour essayer de contrer ces variants en même temps qu'on sort de plus en plus de vaccins toutes les semaines.
To tighten measures. So we are working with them every week.
Good morning, Prime Minister. Theresa Wright from the Canadian Press. Obviously, we're very preoccupied with vaccines today. What are you telling your children and other young people when they ask you, when will I get the vaccine?
Obviously, we know how important it is to protect the most vulnerable, and that's why our vaccine rollout has been focused on elderly Canadians, on people in remote or Indigenous communities, and of course on frontline health workers. But we're getting closer and closer to the point where we will start to vaccinate more and more Canadians. But the imperative is always keeping Canadians safe. Part of keeping everyone safe is making sure there are increasing percentages of the population vaccinated, because that's part of what allows us to be safer as a society. But in terms of vaccination of younger people, we know there is much data being collected right now. There are studies ongoing. And for the latest on that, I'm happy to turn it to the expert and ask Dr. Tam about what the latest is on when we might know about how and when kids might start getting vaccinated. Theresa. You're on mute, Theresa.
Okay, sorry. The clinical trials, as the Prime Minister said, is on a number of vaccines ongoing. So I think first of all, some of the trials started in the older kids, the youth, and then some of the younger population under the age of 12, some of the trials have only just started. So it's likely that we won't hear about the youth, the teenagers, until later on in the year, and then the younger kids beyond that. So sometimes clinical trials can go faster, particularly if the enrollment is fast, and if there's actual disease activity in wherever those clinical trials are done. So the timeline's a bit variable, but that's all I know at the moment.
Good afternoon, Prime Minister. Marika Walsh with the Globe and Mail. For well over a month now, you've been asked what you personally knew about the allegations against General Vance in 2018, but instead of answering that question, you've pivoted to say what your office knew. So I'm wondering if today you can clarify for Canadians what you personally knew about the allegations against General Vance, whether you knew about them in 2018.
No, we did not. We knew that there was, my office knew there was allegations that were brought forward. We did not know the substance of those allegations until the Global News reporting.
Hi, Prime Minister. Mercedes Stephenson with Global News. I want to follow up on Marika's question about what you specifically knew. I understand that nobody knew the substance of the allegations in 2018, but your office was aware that there were allegations made. We've asked your office what you knew about that. In the last 2 weeks, they just keep telling us that you have nothing to add. So I want to ask you very specifically today, Prime Minister, did you know about any allegations of any concerns of sexual misconduct, regardless of the content, in 2018 or before and when you extended General Vance's term and gave him a raise?
No.
Thank you. That concludes Prime Minister's time for, we'll now turn to questions for doctors and ministers. Thank you, Prime Minister. We'll start on the phone with questions. Just in one moment, operator.
Thank you. Merci. Should I go ahead?
Yes,
okay.
Please.
Next question. Prochaine question. Catherine Lévesque, La Presse canadienne.
Catherine Lévesque, La Presse canadienne.
Oui, bonjour à vous tous. Ma question est pour Madame Anand.
C'était
sur AstraZeneca. Je me demandais est-ce qu'on peut revoir le contrat étant donné la suspension pour les moins de 55 ans? Qu'est-ce qui va arriver avec les doses qui nous étaient promises étant donné que la population sera moins grande dorénavant pour recevoir ces doses?
Less people able to receive those doses. Thank you. That's all.
Minister.
Hello. Bonjour.
Good day.
Merci pour la question.
Thank you for the question.
Nous avons un contrat pour 20 millions de doses d'AstraZeneca et
1
nous allons
million
recevoir
AstraZeneca
20
doses,
millions
and
de
we
doses
shall
d'AstraZeneca.
receive
Et aussi, nous avons un autre contrat, comme
those
vous savez,
doses,
pour
and we
2 millions
have
de doses
a contract for 2
d'AstraZeneca
million
Covishield
AstraZeneca
qui
Covishield
vont venir
doses that will
de le
come
Serum Institute in India.
from India.
Donc, c'est 22 millions de doses
So in
d'AstraZeneca.
all,
Ça, c'est
22 million
un
doses from
vaccin qui a déjà
AstraZeneca.
l'approbation de Santé Canada. Donc,
This
pour
already
moi
have been
et pour mon
approved
département,
from Health Canada.
SPAC,
So for me
nous
and
devons
for my
recevoir
department,
les vaccins
that
que
is
nous allons
okay.
déjà acheter.
We
Merci.
will receive the vaccines we've already procured.
C'est Dr. New, peut-être je peux ajouter quelque chose.
Question.
Je pense
Dr.
qu'avec le but vraiment de vacciner les Canadiens le plus rapidement possible, c'est sûr avec les provinces et territoires, les médecins hygiénistes en chef, avec leur déclaration, ils sont tous unifiés. Ils vont ajuster leur programme de vaccination parce qu'il y a beaucoup de personnes, je pense encore plus de 55 ans et plus qui peuvent profiter de n'importe quel vaccin, incluant le vaccin d'AstraZeneca. Donc, je pense que c'est vraiment une question pour les provinces et territoires, mais ce que je comprends, ils vont ajuster leur programme de vaccination pour considérer les recommandations de CCNE.
Merci.
Sylvie?
Follow-up question?
Oui, donc j'en comprends que finalement le contrat reste tel quel, on ne touche pas, vous me dites si je me trompe. Peut-être pour vous, Dr. New, je me demandais qu'est-ce qui va se passer avec ceux qui ont déjà reçu une première dose d'AstraZeneca et qui ont moins de 55 ans. Je me demandais qu'est-ce qu'on devrait faire pour eux? Est-ce qu'ils devraient se tourner vers un autre vaccin? Ou est-ce qu'on va attendre les conclusions de Santé Canada avant de une deuxième dose?
Health Canada before they receive a second dose? Could you please clarify? clarify the situation for us.
OK, merci pour la question. Si on parle vraiment d'une personne moins de 55 ans, et qui a reçu un vaccin peut-être entre 4 et 20 jours, oui, c'est sûr, il faut surveiller pour les symptômes. On a déjà j'ai constaté la liste des symptômes. Je ne vais pas répéter maux de tête et tout ça. Mais je pense peut-être que si je comprends bien votre question, peut-être qu'il s'agit d'une deuxième dose. Je pense que pour l'instant, avec un intervalle allongé jusqu'à 16 semaines, on continue à être informé par les données probantes, aussi l'information que Santé Canada et les autres organismes réglementaires et aussi de santé publique continuent à ramasser et analyser partout dans le monde. Et je pense que quand le temps va arriver avec les meilleures données probantes à date, on va offrir le meilleur vaccin comme deuxième dose pour les personnes qui ont déjà reçu la première dose d'AstraZeneca.
To take for those who've already received the first AstraZeneca dose. Was that your question? Did I answer your question?
Thank you. We'll now go to the next question from the next journalist. Operator.
Thank you. Merci. Next question, Tanda McCharles, Toronto Star. Line open.
Hi there, thanks. I wonder if Dr. Tam or Dr. Njoo or Minister Anand might be able to clarify a couple of things on the AstraZeneca piece for me. How many in that age group aged 18 to 55 have already received the AstraZeneca, given that Canada had already, as I understand it from the website, distributed about 500,000 to provinces? And I wonder, Minister Anand, do you have a cancellation and get a refund on any portion of the AstraZeneca if it turns out that there's such a hesitancy about receiving it, or if it's narrowed so much now only is recommended between the 55 and 65-year-old age group, as I understand it, because you prefer Pfizer, Moderna for the older group?
It's Dr. Njoo. Maybe you can start sort of following up on what I think I said yesterday, based on the data that was provided, and I'm aware of. I think somewhat a bit over 300,000 doses have actually been administered of the AstraZeneca vaccine, or in this case, the one from the Serum Institute of India. I'm not sure. Maybe Dr. Tam has additional comments, but that's my understanding. That's somewhere in the neighborhood of slightly over 300,000 doses administered. Thank you.
Yes, just to add, I think it's around 307 to 309,000 doses, but many of the provinces have been using them in the over 55. So Ontario, for example, have not been using this vaccine. They continue to address the priority populations with the AstraZeneca vaccine. There was a couple of jurisdictions who may have used the AstraZeneca vaccine in the under 55s. But I think actually the vast majority of provinces were still targeting the older age groups. And so I can't tell you exactly, but just to emphasize that we have not received any reports of this rare thrombosis event with low platelets to date.
Minister Anand?
We are receiving 1.5 million AstraZeneca doses from the United States today as part of our contract with AstraZeneca for 20 million doses. And this is an approved vaccine in this country. As the Prime Minister has repeatedly said, any vaccine that has been approved is safe and effective and is the one that Canadians should take. And as a result, we will continue to bring in vaccines to this country following on from the approval of Health Canada for those vaccines, whether it's AstraZeneca, Pfizer, Moderna, or Johnson & Johnson. Thank you.
Follow-up question, Tanda?
Yeah, thanks. So I take that as a no to the cancellation refund business. 31 million Canadians is the estimate of the population over 18 that are supposed to be vaccinated with all the approved vaccines. So let's assume that most of those will be 2-dose vaccines because we don't have a schedule on Johnson & Johnson yet. So that's 62 million doses. Can you give us an update? When do you expect 62 million doses to have been delivered on Canadian soil? What is the schedule also for Johnson & Johnson?
Well, just to refer to your comment before you ask the question, I wouldn't assume that, Tonda. I have said that the terms of our contracts are covered by confidentiality clauses, and I won't be breaching our contracts while we're trying to procure vaccines. Now, on to the question regarding the number of doses. My team can provide the precise breakdown in the numbers of doses, but as I mentioned, we expect 44 million doses of approved vaccine coming into this country at least prior to the end of June. And we are still finalizing the delivery schedule with J&J, but we have had discussions with them, including some correspondence that I was engaged in last evening, and our deliveries of J&J will be beginning at the end of April.
Thank you. Next question, operator.
Thank you. Merci. Next question, Mike Lequiter, Global News. Line open.
Thanks for taking our questions. I just wanted to address this to Dr. Tam and maybe Minister Hajdu as well, and Dr. Njoo can weigh in if you'd like. But like it or not, you've got a bit of a PR nightmare on your hands now with vaccine hesitancy because of AstraZeneca. At one point, the recommendation was not for over 65, then it was. Now it's for not people under 55. Besides just saying, just trust us, what are you going to try and do now or what do you have to say to Canadians who might try and avoid AstraZeneca at all costs?
I don't know, Minister Hajdu's on the phone, but I could start. Maybe I'll do that. And I think just to reassure Canadians that all along the way, the recommendations were informed by the data at hand. So for those who over 65, it was just that there wasn't enough data as soon as the data came in, that the AstraZeneca vaccine was very effective in the prevention of illness and serious outcomes in that group that didn't really come out through clinical trials. Those clinical trials didn't have enough people, but pointed towards that it would be effective. When the UK information and from other countries came in, the recommendation was rapidly shifted so that the vaccine was then recommended for the older age group. And that's based on data that showed good effectiveness. So that's, I think, what everybody needs to remember. This, again, is new data, and it's a precautionary approach for a rare event, but serious. So that is what the recommendation was based on. So I think fundamentally, the important thing is that, especially with safety signals, we want to be transparent and rest assured to all Canadians that the systems are in place and that the vaccines that will be going out for those for whom they're indicated will be safe and effective for those populations. So I think that's really, really key. I think, as the Prime Minister said, the provinces have come down to a consensus position. So when they offer the vaccine locally to you as an individual, those policies have already put in place so that you take whatever you have given to you when you make that clinic appointment. That's the important thing. But it's because we have a rigorous system to essentially analyze that data and put out the recommendations. Yes, this is a rapidly moving pandemic, and the vaccines are put in place, after very good clinical trials. But we will obviously continue to see data evolve. But that it's only to make sure that we have the best and most safe and effective vaccines for Canadians. That's why the recommendations are changing. So I think vaccine confidence is important. So of course, there needs to be more targeted approaches to different population groups. I know that seniors and those who are at very high risk of severe outcomes have been rolling up their sleeves. We've seen them keep coming to get the vaccine. And certainly up to now, the provinces have been using up the AstraZeneca vaccine that they were planning anyways in terms of implementation. And they're just going to start changing their operational stance so that they can deliver the vaccine to the target populations. So I think, again, for Canadians, when the provinces offer you the vaccine, take the vaccine that you're provided.
It's Dr. Njoo. I could maybe add to what Dr. Tam said. I think I understand the question, and certainly we understand that for the average Canadian, there are obviously, I think, a lot of questions and concerns. And I think when the chief medical officers of health met, obviously on a bit of an emergency basis on the weekend, as we discussed this issue, it was top of mind as well in terms of how would this affect the vaccine confidence, or the flip side of vaccine hesitancy. And I think at the end of the day, what's really important and key is that it's good communication and being transparent and open. And that's what I think is very important moving forward. So the chief medical officers of health agreed that they, as the spokespersons as well in their individual provinces and territories, have a key role to play. And certainly giving credible information on a daily basis to the residents of the province, I think, is very important, so that their residents can feel comfortable and confident that the information they're getting from their public health leaders is good, and they should be following, hopefully, the recommendations from their public health officials. Another key group that also needs to be engaged are the healthcare providers, because we know that the average Canadian actually trusts their healthcare provider in terms of getting credible information. And so one of the things that we're doing is working very closely with the frontline healthcare providers, making sure that they're empowered, they have the tools, they have the credible information that they can then use to have informed discussions with their patients, so that at the end of the day, all Canadians can make an informed decision in terms of the best choice, what they should be doing. Which obviously we want to keep encouraging Canadians. Take the first vaccine that's offered to you. Obviously, all of the approved vaccines in Canada have been approved by Health Canada as being safe and effective. Thank you.
Thank you. I'll now turn to the room for questions. Just as a note that we've got about 10 minutes left, so we'll aim for brief answers with equal questions. Thank you.
Bonjour, la question est pour le docteur Njoo. On apprend que le vaccin d'AstraZeneca va changer de nom. Est-ce que ce changement de nom va s'appliquer ici au Canada? Là, je pense que le nouveau nom, c'est Vaxzevria. Excusez mon latin. Est-ce que ça va s'appliquer ici, ce changement de nom? Est-ce que vous pensez que ça peut aider à rebâtir la confiance du public, ou en tout cas lutter contre l'hésitation à se faire vacciner?
Ça, c'est une nouvelle pour moi. Je suis pas au courant avec quand vous avez constaté un changement de nom du vaccin. Peut-être la ministre Anand est plus au courant que moi. Pour moi, c'est comme j'avais déjà dit, que c'est pas un changement de nom pour renforcer la confiance dans les vaccins pour les Canadiens, les Canadiennes. C'est vraiment, je pense, que l'information crédible, comme ouverte et transparente des autorités, les autorités de santé publique dans toutes les provinces et territoires, aussi à l'échelle fédérale, aussi avec les fournisseurs de soins de santé sur le terrain. Donc, pour moi, je pense qu'il y a plusieurs moyens qu'on peut utiliser pour renforcer la confiance dans les vaccins pour les Canadiens et Canadiennes. Et pour moi, personnellement, je pense seulement un changement de nom. C'est pas grand-chose, c'est tous les autres moyens qui sont plus importants. Peut-être je peux laisser céder la parole à la ministre Anand ou peut-être Dr. Tam aussi. Merci.
Dr. Tam or Minister Anand may have something to add. Thank you.
Hi, it's Patty Hajdu. Can you hear me now?
Yes, Minister.
Okay, well, I just wanted to go back to the last question, actually, and let people know on the issue of vaccine hesitancy. One of the announcements we made in February was a $64 million fund called the Immunization Partnership Fund, which is to support partnerships with organizations that work with a variety of different populations across Canada to help Canadians understand their choices around vaccination, to get better access to information in language that they understand best in their own first languages. And I think this is a really important part around working with folks that are worried or anxious about what vaccination might mean for them, is to make sure that they have access to people that can communicate in ways that make them feel safe to ask those hard questions. And so I just wanted to kind of go back to that, because I think this is an important piece. Not everybody will be able to get information in the same way. And at the federal government level, we know that there are many wonderful partners across the country working in a variety of different settings with a variety of different people that need to get information in different ways. And so this partnership fund actually supports their work and allows them to hire people and work in communities in a way that gets information to the folks that need it the most in perhaps different ways that we traditionally think people are getting information. Thank you.
Pour Madame Anand, vous avez parlé d'un début de livraison pour les vaccins de Johnson & Johnson d'ici la fin avril. Pouvez-vous nous préciser combien on pourrait en recevoir en avril, ou en tout cas à quel rythme on va recevoir ces doses-là, peut-être au niveau des premières semaines? Je ne sais pas si vous avez une date précise aussi.
Oui, merci beaucoup.
Je
voudrais commencer par dire que j'ai été constamment en contact avec le fournisseur J&J pour l'implorer de fournir le calendrier de livraison définitive du Canada, y compris hier soir. L'entreprise nous a dit que le Canada devrait recevoir les premières livraisons au fin du mois d'avril, comme j'ai justement dit. Mais c'est entendu des informations fournies actuellement. Nous allons vous donner plus de détails quand le Canada les reçoit.
When Canada receives the information. Thank you.
And did the government of Canada indemnify AstraZeneca and/or Serum Institute of India for any potential litigation over adverse effects caused by their vaccine? And if so, has there been any discussion in recent weeks about potential liability to the government if, and we've seen cases of deaths in Europe that may or may not be related to the vaccine. I'm just wondering if that's something on your radar right now, a possible liability on this.
Okay, well, thank you for the question. I think you and I have discussed this issue in the past, and I have indicated that indemnification clauses are standard in vaccine contracts around the world, including in Canada's. In addition, we have been in the process of establishing a compensation regime that perhaps Minister Hajdu could speak to. But as it concerns the particular vaccine that you have mentioned, we are continuing to procure that vaccine as it continues to have the approval of Health Canada. Thank you.
All I can add to that is, yes, Canada is working on a vaccine injury program to support people that may become injured as a result of vaccinations. We are one of the last remaining G7 countries to have this in place. And in fact, it was a requirement by some of the manufacturers, and it is long overdue. And so we'll have more details as that work unfolds.
Hi, it's Tom Perry from CBC. Just a question for Dr. Tam. Doctor, I'm just wondering, the changing advice we're seeing on AstraZeneca, is this normal for a vaccine, or are we seeing this because of the fact that these vaccines were rolled out so quickly that the advice is changing as the real world information is coming in?
Yeah, I think with other routine vaccines, things evolve in a slower track for sure. As you've seen, as what I've just said, is when the clinical trial data did not have enough, people over the age of 65, and then you get new information in real life that is actually effective. That's the evolving science. So I think I would say partly yes, because this is a fast-moving pandemic, but we are actually getting the real-world data faster than usual as well. So so having the information from the United Kingdom, for example, on the AstraZeneca vaccine, that probably wouldn't have happened that fast in routine vaccinations, but it did occur pretty quickly, and therefore the recommendation was changed. Rare adverse events even for routine vaccines will come up once many more millions of people get vaccinated, and partly maybe because the vaccines have been ramping up really fast. As the numbers of people who are vaccinated builds up quickly, you will then get these signals faster as well. So I think it's just a matter of the amount of vaccines being rolled out across the world quite quickly. But the process itself isn't different. I think the speed of which these signals or data is emerging is faster.
Hi there, Marika Walsh with the Globe and Mail. I have a second follow-up, but I'll make sure that my colleague Theresa, so I'll alternate. Dr. Anand, Minister Anand, I'm wondering if you can clarify specifically the timelines for vaccines now in Canada, because while you're announcing the speed up of deliveries of Pfizer, we have not yet, for example, received any information about the delivery of the core 20 million shots from AstraZeneca through that bilateral contract. So you're saying more than 40 million now by the end of June. Can you please just clarify what are included in that and what is happening with that main AstraZeneca contract for 20 million doses?
Sure, I would love to clarify it, and I'll give you some numbers broken down, and my team can reiterate them if you miss any of them, okay? So you know that we have 9.5 million doses coming into the country prior to the end of the week. And of that 9.5 million, we're going to be receiving 1.5 million from the United States. That 1.5 million is actually part of the 20 million AstraZeneca doses which Canada has purchased. So you have to consider that as the beginning of our deliveries of the 20 million. Okay, I was talking with AstraZeneca yesterday, in fact, about this and pressed them for the deliveries going forward, in addition to the 1.5 million doses coming from the United States today. They confirmed that we will be receiving at least 1 million AstraZeneca doses in June under the APA. That's in addition to the 1.5 million doses coming from Serum and the 1.9 million AstraZeneca doses coming from COVAX. So if you put those AstraZeneca doses together with our Pfizer deliveries of 17.8 million and Moderna of 12.3 million prior to the end of June, you arrive at 44 million. Thank you.
Hello, this is Theresa Wright from the Canadian Press. My question is for Dr. Tam or Dr. Njoo. Most drugs and vaccines come with side effects, and some, like birth control pills, have a much higher risk of blood clots than the AstraZeneca vaccine. So why do you think that vaccine confidence in particular is so easily swayed by any reports of side effects when there are other vaccines and other medications that have greater side effects?
Yes, as you said, medications have side effects, and they're listed in the product monographs, and some of them, again, will change as more data comes in. So that's actually quite common for any treatment and medications. I think partly it's because vaccines are provided to people who are well, whereas treatments are generally provided to people who have a medical condition or who are sick. The birth control pill is actually quite an interesting analogy because that's also generally in people who are well, but who have a particular need. I think that there's partly is because it's a preventive measure. And so the bar is pretty high for the risk and benefits. But you're in the middle of a pandemic with people who are, look at the deaths, hospitalizations, ICU admissions every day. I think then it's important to point out in very real terms to everyone what that risk actually is, and then explain that to the individuals as they are coming to get the vaccine. But yes, there's many different underlying drivers of vaccine hesitancy, some of which, of course, is related to misinformation. But I do think that the bar is set a bit differently for risk and benefit, just because you are giving a preventive measure to a well person.
It's Marika Walsh again. I have another question for, I believe, Minister Anand. The shots coming from the United States this week, 1.5 million from AstraZeneca, have those gone through all of the Health Canada approvals, and will they be shipped out right away? Or what do they still need to go through at Health Canada, and when will they actually be delivered to the provinces?
Maybe I can take that question. The doses from the Americans are under review right now by Health Canada. Each, as I've explained before in this forum, each vaccine is assessed on the data of the vaccine itself, but also data is assessed from manufacturing sites and indeed batch numbers. So those doses will be carefully scrutinized by Health Canada before they're released to provinces and territories for use.
So when will they be delivered then to provinces? What's the timeline?
It will depend on the data review done by Health Canada. Maybe Dr. Tam, you have more up-to-date information as I do, but my understanding is that they're still awaiting some of the information from the manufacturing site in particular. But that data, that information may be a couple days old, and I know Health Canada is working very closely with the corporation to make sure they have the appropriate information so that they can provide the regulatory approval for those doses.
I might just add something from the procurement standpoint after Theresa. Go ahead, Theresa.
I was just going to say we will have to check in with the regulator. I don't have any more information.
So from a procurement standpoint, the regulatory review of the additional manufacturing sites is to be completed in the coming days. That's what I was made aware of from the supplier late last week. But the procurement part of this is that the doses are being pre-positioned so that they're ready for distribution once the Health Canada approval has been obtained of all the necessary elements.
Thank you. That concludes today's press conference.
Thank you. The conference has now ended. Please disconnect your lines at this time.